Brian Goldman is here. He is the author of The Secret Language of Doctors. They have a secret language?
Of course they have a secret language. Don't broadcasters have a secret language?
We kind of do. We have little terms that we use that nobody knows what they're about, only us, but you guys do too?
Yes, we do. There are so many reasons to have it. We have a secret language to talk about patients, to talk about situations that we find challenging to talk about, sometimes to talk about colleagues, maybe not a specific colleague, but a different kind of specialist. So you have internists talking about surgeons, calling them cowboys, and you have cowboys calling internists fleas, and everybody calls emerge physicians like me referrologists, because we're always referring patients to other people, and that's what they think we always do.
Now, this is not a secret anymore after this book, but you know what? This is really interesting stuff. We already know certain terms like code pink and code red, code white, code brown.
Okay, so all the others are legitimate terms that are used in hospitals to talk about certain kinds of emergencies where you want to mobilize force. Everybody knows code blue. That's a cardiac arrest, yes, because of shows like Grey's Anatomy. But a code brown is a poop emergency.
I figured that.
Yeah, and who has all of the code brown stories, which I've got in the book? Doctors or nurses? What do you think?
I'm going to say doctors.
No, doctors not, because they don't clean it up.
No, the nurses
So the nurses do. So that's a chapter that's all about who does what in the hospital.
Okay, so let's talk about some other terms. The Darwin Award.
The Darwin Award, yeah. Darwin.
Okay, that was Darwin Award. Yes.
Darwin from Durban. I don't know.
Yeah.
The Darwin Award refers to, this was given to me by an obstetrician out in the West Coast, referring to women who choose a home birth but under very dodgy circumstances. A home birth in the middle of winter when they're a long country road away from a hospital in case of an emergency. And
why would somebody do that?
Well, yeah, and that's coming from the perspective of the obstetrician, that so a long country road, they get snowed in, that's when they have their baby, and then 5 days later, when it's obvious that they're starting to have a postpartum hemorrhage, that's when they need to be rushed to hospital. They appear now, they're in septic shock because now they have a fever and their blood pressure's like 60 or 70 and they have to be saved, and the obstetrician has to kind of dash in at the last minute and save them, and hopefully save their womb so they can have another child. So is it surprising that they would invent slang to deal to talk about some of the situations that they have to deal with?
Actually, it's not surprising at all. What's another term that you want to talk about? There's so many here.
Well, how about status dramaticus?
Okay.
So that's a takeoff on status asthmaticus, and that's a legitimate term. That's Latin for somebody who's in a constant state of an asthma attack, meaning that they haven't taken 2 puffers and it's gone away. Pretty scary.
Yes.
Status asthmaticus, that's an emergency, and somebody could actually die, and they get rushed to hospital. Status dramaticus is not quite that. Okay. That's somebody who's in a constant state of dramatizing their symptoms, often showing up in the waiting room of an emergency department, pretending that they're about to faint. Oh, I can't take it, and grabbing all the attention. And you know, if you're a casual observer in the emergency department, you can't help but notice that the amount of time that emergency doctors and nurses spend with a patient may not be directly proportional to the gravity of their illness, and so that's a real problem.
Your first day, were you shocked at this language?
Oh, yeah. The first day that I was on call as an intern in a pediatric hospital, after that night, my senior resident, who was trying to teach me the ropes, comes in, puts a reassuring hand on my shoulder and says, "Well, now, Brian, how many did you box last night?" Box as in put into a coffin. And I almost slumped until his face started to break out into a tiny grin.
Yeah.
And that was like the secret handshake. It was like, welcome to the secret language.
Yeah, there you go. And there's a lot more of it right here in The Secret Language of Doctors by Dr. Brian Goldman. And of course, we have a link on breakfasttelevision.ca if you want to get this book. Very interesting. We're heading back into you, Kev. Thanks very much.
My pleasure.